Alright guys, so for this week's discussion, I'm going to be covering the topic of oral cancer. So oral cancer, it can occur right in the oral cavity, so that region is going to consist of your lips, the cheeks, the gums, but it can also occur in the oropharynx, so that's going to be your throat, your tonsils, the pharynx region of the mouth and throat. So signs and symptoms of this for patients, they often complain of a soreness that won't go away. There can be some pain and palpable tenderness upon assessment. They may complain of feeling like there's a lump, difficulty with chewing and swallowing, kind of like they can't clear their airway, there's something there they can't clear. Another sign and symptom of oropharyngeal cancer is patients see a change in their voice. In oral cancer of the mouth, they often see that their teeth may start to shift because of the growth from the cancer. So from a risk point standpoint, patients who are smokers, like always, that's your biggest risk right there. For oral cancer. Men are also twice as likely to develop oral cancer compared to women, and especially in the age group of 40 to 60. People who also are excessive drinkers, don't maintain a proper balanced diet and exercise, they are also people who are at risk for oral cancer. So if you are all of the above, not a good thing. Some nursing interventions that we can do for these patients. First and foremost, especially when you have your patient with the oropharyngeal cancer, we need to maintain a patent airway. As we start to see these nodules grow, like I said, huge risk for difficulty swallowing, aspiration, and difficulty with speaking and communicating as well. We're going to monitor their daily weights. Often people who are going through cancer treatments are very nauseous. They have a lot of pain, which leads to a loss of their appetite. So we want to make sure that they have their properly taken daily weight so that we can monitor their nutrition. Of course, we're going to manage the pain for the patient. We want to make sure that, although they're undergoing treatment, they're not in excessive pain, that we can control, especially if it's causing them to become immobile, because then that just throws in a whole bunch more risk factors for, DVT and things like that. This entire process for patients can be really depressing, so you want to allow your patients to communicate with you how they're feeling. As their voice starts to change, they may lose their ability to speak altogether as things start to turn for the worse. They're unable to go to social events, out to dinner, things like that with friends, because they do have the difficulty with speaking, eating. So it can be really depressing. Patients tend to kind of stay by themselves. You want to make sure that they have the proper ways to communicate both with you and, also their support system and friends and family.